Hello and welcome to my YouTube channel. My name is Lorena Dunker, and if you have not subscribed to this channel, I encourage you, please subscribe. If you are my followers and just watching without subscribing, please subscribe. Today we have a guest that will be talking to us about a particular disease. If you have been following me, I have repeatedly said that we're going to have guests that will come and talk to us on training issues or talk discuss topic in the area of specialty. And today we thought it wise to bring somebody who has specialty in a particular field. 3 or 4 days ago, the WHO declared a particular disease as public health emergency internationally, and I think it's just right to get somebody who has knowledge in this area better than me to come and talk to my audience. So today I have invited a public health specialist, and he's going to be introducing yourself. So please talk to my audience. Sorry, guys.
Thank you for the invitation. My name is Mr. Albertus Nyamiana. I am an epidemiologist by training and also an environmental health scientist, and also have extensive training in infectious diseases. So I'm privileged to be on this platform, and I'm happy that you, the listening audience, can also follow up on some of the trending issues that you will want to know. Unfortunately, this is not a platform that you are able to ask questions. However, we'll do as much as we can from those questions that will be answered.
Yeah, so maybe if you have any question, if you're watching the video, you have questions, just drop your questions in the comment section, and I will be able to pass it on to him so that he can answer them for us. Or if I have answers to them, I will answer it and then respond to your questions. Yes. So, Mr. Miana, 3 or 4 days ago, I read from the news that WHO had declared a particular disease called mpox as a disease of public health emergency. So I would like to know, what is mpox?
Mpox, the name was originally called monkeypox because it was assumed that the reservoir is monkey. However, later studies have shown that it should be called mpox instead of monkeypox because it has not been established yet the reservoir in totality to be monkey. So it was first discovered even as far back as 1958. It's one of the re-emerging diseases of our time. As you may be aware, disease like smallpox was eradicated before, and it has the same signs and symptoms with that of mpox. It starts with fever, and then it comes with rashes. But there's a distinct difference between mpox and smallpox in terms of the type of rashes that appear. So the rashes will first appear on your forehead, it will also appear in your palms, and then it will also appear under the soles of your feet. Those are the distinction between those rashes and those of smallpox or measles. And the incubation period, the time it takes to actually present as disease, is between 2 to 4 weeks. So between those times, you will see the rashes appearing. But what is important for you to know is that the rashes can either be macular rashes or papular rashes. So in this case,
So what's the meaning of macular and popular? Because my audience want to know.
yes, that's what I want to explain. The rashes will start being flat at the moment with fluid in it, and later it will be elevated, and then it will be sharp at the end of every rashes. So in that case, you will know that it is not those rashes of measles. And most importantly, the location of the rashes will tell you that it is mpox, because it will appear in your face, it will also appear in your palm, and it is not normal with measles and even smallpox. They do not appear in the palms, they do not appear under the soles of your feet.
Okay, so thank you so much. Thank you. That's why. So, at what point? Okay, let me say this way. So, this impact, is it something that is contagious? Can somebody get it from another person who is affected with it?
Yes, it is contagious, but what I wanted to say, some information I want to pass out from the background is the mpox is a zoonotic disease. And when we say a disease is zoonotic, it means it comes from animal to human. So if you come in contact with animals that transmit this disease, like most importantly, those bush animals are the ones that transmit the disease. That's why it originally got its name monkeypox, because it was believed that it comes from monkey. But monkey themselves have been victim of it. They themselves have been infected with it. So it's a contagious disease. And when we say a disease is contagious, it means it is transmitted through contact. Once you come in contact with someone who has it, you are likely to get it. So the transmission between human to human is very fast, as even compared to animals, because you know we humans play with one another almost every day. You ride vehicles, and somebody who has the disease that is sweating, once you exchange body fluid with the person, you are likely to also get that.
Okay, so um, thank you so much. So it's contagious. That is to say, if I have this disease, you can get it from me if you come in contact with me. So you talk about body fluid. What are other means that someone can pass the disease to another person?
So one of the fastest ways of transmitting this disease from human to human is through sexual intercourse. Is you can,
So
yes,
this disease is also a STI.
yes, it can also be transmitted through sexual transmission means. So we consider it to also be STDs or STI, if you may call it. STD will mean sexually transmitted disease. So if you even case a person that has this disease, the fact that you have exchanged body fluid through the mouth, you can also have it. But what is important to know here is that this is common amongst people who are homosexual, men that sex men. This is very, very profound among this population. And even sex workers, people who are sex workers, you can really have this disease. So when we are actually trying to look at the epidemiology of this disease, the population of interest will be those who are sex workers, those who are homosexual, homosexualists. Those are people that you will want to actually check. And it's a disease of also sanitation. What that means is, if you have a filthy area where somebody has dirty clothes, or the bedding is not clean, and somebody lies on it, has not been changed. So in this kind of outbreak situation, if you were to travel and go into a guest house, the lining that is being used on the bed, if you are not comfortable, remain right there for it to be changed. Because if somebody who has this disease slept on a lining and then exchanged body fluid that is left over, you are likely to get it, because this is a viral disease. It is a virus.
So what I'm understanding from you is that, I mean, the mode of transmission is not, I mean, the the way it is transmitted to another person is not just through sexual intercourse, not just through kissing, but also change of body fluid. Like if I sweat in the clothes and I have it, and somebody wears it, they are likely to come down with that disease.
Exactly. That's why we are even advising that if you were in an outbreak situation where this disease has spread all over, distancing is very key. That means you should not just get in close contact with somebody. Even if you were to ride commercial vehicle, there should be distance between you and the next traveler. Otherwise, if the person has it, you are likely to get it through just by touching the person who has that.
Okay, so take you this far. So, from your opening statement, you said the disease was first discovered in 1958. So it's one that is re-emerging, like many other diseases have been doing. So, have there been any case of this disease in Liberia?
Yes, there have been cases of mpox in Liberia. Cumulatively, we now have 30 cases confirmed, laboratory confirmed cases since the 2021 May. We recorded a first case from Riverside County, and since that time up to now, we have recorded up to 30 cases. The most recent of them have come from 3 counties, Maryland, Riverside, and Nimba counties.
Okay. So my understanding is that the index case of mpox in Liberia was first in 2021
Right.
in Riverside County.
Right.
And you have 30 cases in total in Liberia.
Right.
Okay, so we know many diseases break out. Why it is key to follow the trend of the diseases and how it is spread and what the rest of it. One thing that is also important is the death rate. So has there been any death recorded for this disease in Liberia?
No, not as of yet. The good news about it, even globally, not just Liberia, is that the CFR, that is the case fatality rate of this particular disease, is very low.
Okay.
And in fact, we do not have any definite treatment for this disease as of now. So what we do is we give supportive treatment.
Okay.
When somebody is diagnosed of this disease, you tell them to observe hygiene. Make sure that you maybe change your clothing 3 or 4 times a day, and the ones that you have used, you can boil it. If you don't want to boil it, maybe you can use chlorine solution to make sure that you clean it, just so that the virus will not survive, because you know the virus of this kind is actually not as strong as the other viruses. So by the time you wash it with soap and water, it is actually going to disappear. So this is what we call a disease, of sanitation concern. But like you rightly said, in recent time, around the Africa regional office of the WHO, we call that Afro region. So the regional office of the WHO has now announced to us that this disease, because of the magnitude of confirmed cases reported around the region, cases have been reported in Rwanda, Burundi, Malawi, and most of these cases are cases amongst more especially the young people. So because of the magnitude of confirmed cases in recent time, the issue has declared it as public health emergency of international concern. And what that means is, it means that the disease has the potential of crossing from one country to affect the other country. So whenever the WHO announces that this disease is a disease of public health importance of international concern, we have algorithm in the international health regulations that show to you, that answer few questions. If this disease has not occurred here before, yes. Does it have the potential to cross to other country? Yes. So if 2 or 3 of those questions answer will be yes, that means you can declare such disease as a public health emergency of international concern. So that is the decision-making tree in the IHR that will determine the WHO to say that. So for us as public health specialists, when we hear that, what it means is we have to tighten our borders. We have to do screening, most especially entry screening from countries that have been listed. When people are entering your borders, you need to screen for this disease such that it cannot, be imported into your country. Otherwise, you might have problem. Though, as we said, the CFR is very low. As of now, we have not recorded any death attributable to mpox in Liberia. But what is important is it is a disease of concern that we cannot just cross our legs and say, since CFR is low. People may have comorbidities and contract it. Comorbidity will mean that you already sick and you have this disease. So it could exacerbate your problem and even cause death for you. So we don't need to sit and say, since the CFR is low, we should not, keep our borders tight. So we need to instill entry screening and make sure that this disease does not enter here and in its high number, even though we have it here.
Okay, so somebody who is listening has no knowledge on public health, has no knowledge on epidemiology, wants to know what is CFR.
I said that. I said the case fatality rate.
Okay.
Okay, once we say case fatality rate, it means fatality in itself is mean death. So the cases are the ones that are harboring the disease. So the rate is such that the number of people who have the disease, the number of people who have died of the disease will be the numerator over the number of people who have the disease times 100. What you get there is considered to be the case fatality rate.
Okay.
That's how we calculate it.
Okay, thank you so much. So just to let my audience know again, so we said from 2021 to present, we have 30 cases of mpox in Liberia. There have been no death recorded for this disease. And he said globally, the CFR, which is a case fatality rate, globally is very low. However, there is still need to be on the watch because of the way it is spread from one area to another. And so Liberia, like any other country in the region, is part of this. So what are you people, the public health specialists in Liberia, what are you doing in regards to this declaration that have been made by the WHO?
As usual, when we hear the World Health Organization announcing a disease as a fake, what that means for the country is for the country to heighten surveillance. To heighten surveillance will mean that you should make sure that all of what you're supposed to put in place to detect this case is being done. What you need to do in case of response is being put in place. So as a country, what we have started doing immediately as of last week was to ensure that we do what we call IAP. IAP is Incidents Action Plan. We have decided to prepare an Incidents Action Plan, and in that Incidents Action Plan, it will look at prevention, detection, and response. And we also look at other pieces like the RCCE. The RCCE is the Risk Communication Community Engagement, that you will create awareness about this disease. And in that plan are other factors that we have also captured, and it put us around what you need if you were to have a case to respond to. So the preparedness kit have been placed there to make sure that you outline PPEs, for example, personal protective equipment, because this disease, as we said, is contagious. So if you were to respond to it, it means you should wear the risk appropriate PPEs. So what all it may take if there were to be an such of the case, that means you have so many cases, what it will take to respond to it, all of those have been put in that plan. You don't need to wait for you to have too many cases before you can respond to it. So what we have done is to make sure that we have the plan, and that plan is costed, and then we do resource mapping of other areas. Like, you have several pillars that you're supposed to also activate. As it is now, we have also made sure that the EOC, which is the Emergency Operations Center, is elected, so that meetings can also be done. Because in as much as you have an incident and you do an RAP, it means you should have incident manager, and the EOC should also be activated, and you should have coordination meeting to discuss how you can make sure that this disease does not actually get to the magnitude that will not be controlled in Liberia. So those are mechanisms we have put in place. And in this week, today is Sunday, this week we will be mapping our partners that are supposed to maybe fund some of these pillars that are in the incident management plan. So this is where we are now.
Thank you so much. So what this explanation means is that Liberia is ready to combat the disease in case there's an outbreak. Although we have 30 cases, but just in case that it becomes something that is considered an outbreak, Liberia is ready. For our experience with Ebola, I mean, our public health specialists, they are always on top of the game, and they just need the support and the funding so that they can be able to protect us, the citizens who don't have knowledge in public health. Okay, so thank you so much, Mr.
Yeah, so let me just land on this. So this disease has threshold for what you call epidemic, and then what you call alert.
Okay.
So the epidemic threshold, we also call that action threshold. That means when you reach that number, you are in outbreak.
Okay.
So when you have a confirmed case of mpox or two, you are already in outbreak.
Okay.
Yes.
So you already got an outbreak in Liberia?
Yes,
Okay.
we have been having outbreak. But what happens is that the outbreak is not of a magnitude that
okay,
will cause the entire country to say, well, we have
panic.
this.
Okay.
So the public health specialists have had the tenacity to contain those outbreaks in their locations, so it has not caused any issue that will cause the country to stand still. But cumulatively, we said it was just 30 cases since that time. So if you were to do the distribution per time burden, you will find out that sometimes in a month you may have one case, sometimes in another month you have maybe one or two cases. So if you were to disaggregate those 30 cases per the time over, it will not be of any much concern because it did not happen one time. So once you are notified of a suspicious or suspected case of mpox, that means it is an alert. So you should be alerted and know that you might have a confirmed case. And the good news is that our laboratory in Liberia, the National Public Health Reference Lab, has the in-country capacity to test for mpox. So in this case, whenever we suspect a case, what you do usually is to take specimens, and the specimens are three. You either take the swab, which will be the body fluids. You do the crust if the blister or the rashes have already opened. The crust is where the rashes were, you just scrape it, and then whatever comes from there is part of the specimen, or you take blood. So those three specimens are what you require for the mpox to be tested. And once you send it to the reference lab, your result will come and they will tell you whether it is mpox or not. But we want to urge the public to make sure that whenever you are going out, have your sanitizer, or make sure you always wash your hands whenever you use either the latrine or public place. Whenever you are in public place, make sure you wash your hands when you touching anything. because we have something that we call direct and indirect transmission of diseases. So those pathogens, whenever you touch surfaces where somebody has it, have touched, if it is a virus, it may live there and you may put your hand there and also take it along with you. But the best thing to do is when you touch anything and you wash your hands, you are safe. So we urge the public to make sure you observe, also just not sitting closer to somebody, in a vehicle, because whenever the person is sweating and that person has the disease and you exchange that sweat with the person, you may likely get it. So we also want to tell you the good news is that this disease does not have high case fatality. It's not that virulent as other diseases are, but it is not a guarantee that you should not protect yourself. Thank you.
Okay, thank you so much. Thank you for the time. Thank you for the message. I mean, that was good. So mpox originally were called monkeypox, and mpox is declared one of public health emergency. And then from 2021 to now, we have 30 cases in Liberia, no death recorded. And globally, the CFR of that case is very low, unlike other viral diseases. And he said the distinction between the sign and symptom of mpox and maybe measles, for example, for measles, you will not have blister coming in your palms, you will not have the blister, the sole of your feet. So that's some of the distinction. So when you have blister in your palms, under your feet, I mean, the best thing you can do is to get to a health facility so that you can report, and then maybe they can get your specimen that he said to be sent to the lab. So that was it. If you have any question, any concern as it relates to this topic, please drop your question in the comment section, and please do not forget to subscribe. Again, this is your girl, Lovina Dunke. Thank you. Bye bye.